So it's the fall time, and this is a wonderful time of year to start planning ahead if surgery is in your plans for 2026. In this video, I'm going to give you my top tips to implement now in this time of year to make things a lot smoother for yourself if you're planning for surgery. So first things first, if you're employed and you get your insurance through your employer, it's usually open enrollment in season right now in October. So now is a good time to go and find out more about your benefits. One really effective way to do this is make an appointment with HR, and you can ask them, do you have out-of-network benefits? Do you have coverage for gender dysphoria? And what are the different plans you can enroll with to better cover your expenses if you're going to do surgery next year and your healthcare expenses may be a little bit higher than usual. Also, do you have a health savings account? Can you put aside extra dollars before tax that can go towards your surgery, your medications, your post-op care? A flexible savings account otherwise is not as good because it doesn't roll over to from year to year, but that is also something to think about. While you're in there, ask them about leave policy, medical leave policy. Do you need special paperwork? How long do you have? Is your job safe when you're gone? Does the company allow you to come back and do light duty, for example, or do you have to be able to lift heavy when you come back to work? Now is a good time to ask all those questions and figure out where you stand. Next, it's a good time to start looking at different surgical practices. Many surgical practices are super busy up until the end of the year, but then January, February, it can be crickets. So that can be a really good time to get in, get your appointment with your surgeon and start making plans for surgery. Do you have a primary care doc? If you don't and you are able to get a primary care doc, now is the time. Having a good supportive primary care doc is super important around the time of surgery. It's really important, for example, if you have to travel for surgery, which many folks do, a primary care doc at home is really useful. And oftentimes we have to do different things like screening, maybe mammograms, things like that before surgery, blood tests even, so you'll need to be able to go to your primary care doc in order to prepare for surgery, so it's better to know them now. And just one last point, it can sometimes make a lot of sense to do your surgery earlier in the calendar year. The reason for this is if, for example, you're doing bottom surgery, where there's two parts to bottom surgery, and let's say in vaginoplasty, there usually is. In my practice, most patients will want or need to do a labiaplasty later on. It can make a lot of sense to do everything in the same year because you're going to reach your deductible in that year, especially if you're a young, healthy person, and therefore that can decrease the costs out of pocket. So just something to think about. These are great things to do in the fall to prepare yourself for surgery next year.